Hello, hello. Good morning. Good morning, Lithuania. Good morning, South Africa.
Good morning.
Dear Doctor, how are you?
Very good, thank you. Nice, very nice to be here. And I thank you very much for asking me.
You're welcome. How is the weather like in South Africa?
We are now entering summer, so it's a lovely day in Johannesburg. I live in Johannesburg, which is, of course, the biggest city in South Africa.
And it's summertime now.
It's springtime now, but we go from winter in one day straight to summer. We are always having a very good weather here. It's one of the nice things about living here.
Wow, it's amazing. Now we are entering autumn in Tunisia, and I guess in Europe, winter maybe starting very soon.
Yes, but of course, come March or April, we feel very jealous about your nice weather there.
Yeah. So thanks for being with us, Grandmaster Ella. I can't hear you.
Okay, hello to everyone who watched us. I'm really happy to have you here because you are very special guest, and of course, we like to know about your background. At first, maybe the best thing is to introduce yourself.
Well, thank you. My name is Roos. I'm from South Africa. I trained as a plastic surgeon and practiced for many years in private practice. That ended 10 years ago when I started getting really interested in hypochlorous acid, which I believe has a fantastic future in the aesthetic market. And I started doing research on how to make a very clean solution of this product. For many, many years, the medical profession has tried to make hypochlorous acid, and with new techniques that was developed in nanotechnology and electrochemistry, it was possible to make a very pharmaceutical grade product, which has a huge application in the aesthetics market. And I believe in Phiremoval, it will have a fantastic benefit to those who have it in terms of preventing complications and in terms of enhancing the results.
Actually, I truly believe that, hypochlorous acid will have a great future also in permanent makeup procedures, because, you also open the skin, and also we are doing some special treatments for the skin, and it always will be helping. And actually, we like to speak now about benefits which we can get from this acid when we perform our Phiremoval procedures. Let's speak about.
Good. First, the molecule hypochlorous acid. If you understand where the molecule comes from, you'll understand how it can benefit you. So this molecule has only 3 atoms: hydrogen, oxygen, and chlorine. It's a very tiny molecule, but it is one of the most important molecules in the human body. It is the molecule that is responsible for our immunity. So in our white blood cells, when we are faced with infection or with an injury, of course, makeup or permanent makeup removal is an injury. It's an induced controlled injury. Then the body mobilizes the white blood cells to go and heal and to go and prevent infection, or if there is infection, to go and stop it. This is called our innate immunity. So there are 2 types of immunity in the body. There is the immediate immunity, and that is if you, for example, pick up a virus or a bacterium, or you get a cut or an injury on yourself. Then the white blood cells mobilize and they go there and they start to heal. And they do it with hypochlorous acid. So this is the immune molecule. It releases this hypochlorous acid molecule where the injury is, and then this molecule has a profound effect on that wound that culminates into the control of inflammation, the killing of any germs if they might be there, and the fast healing. So having hypochlorous acid in your hands gives you a massive advantage, because it's like a It's like a huge immune response that you can direct right there where you need it. Say you're doing permanent makeup, and that area that you do the makeup is going to get the normal reactions that you expect. It's going to get inflammation, it's going to be sore, it's going to be red, and it's going to take time to heal. If you apply hypochlorous acid before you do that treatment, there is virtually no risk of infection because it is one of the most powerful germ killers in the world. So it is extremely antibacterial and antiviral and antifungal. The next thing is it is one of the most powerful anti-inflammatories in the world. It is more anti-inflammatory than, for example, cortisone, but it has no side effects like cortisone.
Yep.
And then the third thing is it stimulates healing. So in the aesthetics world, if you apply this before the procedure, you have very little risk, if any, of picking up an infection. You have very, very little pain associated with the healing because the inflammation is under control, and there is virtually no redness after a few hours because the inflammation is brought under control, and there's very little swelling. Now, consider a wound where you have you've introduced pigment. You're doing a permanent makeup, or you introduce your removal products like glycolic acid or what you use. That creates an inflammation. That inflammation means that there is a whole process happening with blood vessels dilating, and they leak liquid, and there is swelling, and when that happens, there is a restriction of blood flow to that area where you worked. So that could create an avascular necrosis, what we call. There is a loss of blood. There's a loss of oxygen delivery, and that area could develop necrosis. It can die. If you control the inflammation, and you can dramatically control the inflammation, and I'll show you a few examples what it looks like, then there will not be necrosis. But say even if you develop necrosis for whatever reason, and you have to remove this dead tissue that is there, the one thing that makes hypochlorous acid really exciting in the world of aesthetics is that it creates healing with almost no scarring. And I'll show you some examples. It is really remarkable how it can heal a wound in a very short time with virtually no mark that is left. And this is the exciting thing for me for fire removal, is that you can not only control infection, control the pain, control the risk, but even if you develop a wound, it can heal very quickly with no marks, no scarring, and no keloid formation, which is really a long-term thing that could create some concern.
Okay, that's great. You know, before, yeah, it was very interesting to listen you, because before to start to work with your products, I get this also. You know what it is. It's very short conclusion about your products, and I tried one of your products, GF1, and so I need to share my impressions. My clients got, less inflammation. Of course, they get no swelling and no irritation. It was a big surprise for me, because after these procedures, you always get more or less irritation. And of course, healing was just perfect. So that's why it was very interesting for me. And I tried to talk with Thomas. Oh my God, I needed to know more. And please invite Dr. René with us, because for our procedures is this excellent products.
Yes, I think it's really important to embrace the modern technology. And the hypochlorous acid could open up a whole world. Another interesting aspect is, as you very well know, if you create inflammation in a skin of Fitzpatrick, say 4, 5, or 6, it's a darker skin. They have a risk of having pigmentation. Yeah. In fact, that is the way that the skin reacts. Is if it's inflamed, it goes darker. That's how we suntan. So if we create inflammation through a procedure like a tattoo or tattoo removal, the risk is there that you will create pigmentation because you initiated inflammation. And if the background color is somewhat darker, the risk is much higher. So consider this. If you can control the inflammation, you can also now do tattoo removal or tattoos in darker skins because you don't have the risk of pigmentation. And we see that. So in that case, we say if you're going to apply hypochlorous acid, always apply it before the procedure. Yeah. You can apply it during the procedure because it doesn't interfere with the ink or the ink color. And you can then apply it every half an hour, say after the procedure. But if you have a darker skin, like a 4, 5, or 6 Fitzpatrick, start 2 days or 3 days before the procedure and let your client apply the spray on the area where the makeup is going to be applied. And that suppresses any inflammatory reaction that may happen during the procedure. So you have a further assurance that there would be no inflammation. So you limit your risk tremendously.
Okay, but it also helps in a case of hypopigmentation, right? Also.
Yes. Well, hyper and hypopigmentation are both the results of inflammation. In the one, it's just more severe, where you destroy the melanocytes or the cells that are responsible for creating the pigment in the skin. So the control of inflammation, in fact, is not only very important in the case of fire removal, but it's creating a lot of buzz all over the world in terms of skin aging, the results of aging, the inflammation. The inflammation that's the cause of aging is now called inflammation aging. It's proven beyond doubt that a low grade of inflammation in the skin gives you the aging. Now, what happens with aging in low-grade inflammation is that we get these tiny little brown spots all over in the skin. They're called lentigas. And that is it's a sign of the pigment cells in the skin. When they are chronically exposed to inflammation, that they start to misbehave. They don't know how to do their job properly, and that is to create an even pigment in the skin. Now, it's been showed in a study in the University of Stanford in California that even these cells start to behave normal again if you expose the skin to hypochlorous acid. So it's got many other benefits other than helping you around this permanent makeup procedure. It can also help your client, and this is where that GF2 product comes in, to create a lower inflammation profile on the skin, and things like acne, rosacea, seborrheic dermatitis, these problems that are associated with older skin, they disappear as well with hypochlorous. It's really a fantastic new development in medicine and in aesthetics.
Yes, I feel it all my body. I just listen to you and I feel in my body that that's exactly what we require for our procedures. Yeah. Okay, I have a question also, one more. Are you making some educations, for example? Are you traveling around the world to have this educations with your products, and just with explanations like presentations good, or are you doing this or not? Or you don't have time for that?
No. That's pretty much my job. Yes, because I'm from a medical background. I love giving presentations and I love teaching people this new technology. I find it fantastic to do that. I hope to also be able to teach you formally at a conference when that happens. The science of hypochlorous acid is fascinating. There are so many things that you need to know, or that would interest you. If you want to know how it works, it's precisely explained. It's published in peer-reviewed journals how it works, and these different qualities are therefore, it's not a mystery. And I want to make it clear that if we talk about hypochlorous acid, we are not talking about ozone. We're not talking about peroxide. We're talking about real science, medical science. Hypochlorous acid, for example, is very prominent in the potential future treatments of cancer. because it was found in that same university study that I mentioned earlier on that it normalizes abnormal skin cells in the skin. So the cells, say for example, you have a chronic exposure to the sun, and then you have a very sun-damaged skin. These red skins with small little precancerous lesions, and they constantly have to be treated with liquid nitrogen or cut out. If you apply that on the skin, those lesions disappear. And even early skin cancers that are traditionally treated only with surgery, they improve dramatically in the presence of hypochlorous acid. So I also think that has a fantastic future. And then the other things is in lung pathology. There is also a very interesting research going on there because of the combination of killing of germs and anti-inflammatory, because a lot of diseases in the lungs, like asthma, for example, is inflammatory driven, just like the effects of HIV in the lungs. So we're talking medicine now, but these are the wider things that interest the world about hypochlorous acid at the moment. The point is that you can use it with safety, because it is proven to be 100%. It's amazing that a product that can be so effective can be so safe. It's got FDA certification as GRAS, or generally recognized as safe, as they call it. It has multiple safety certificates. It's multiple safety studies has been done. It doesn't have any danger to a woman who's pregnant or to a child. And of course, Thoclor Labs, our company, has a European safety certificate, which is a separate, quite a stringent certification process that we went to. So the product is available in Europe and registered for sale there. And because of the safety background, it can be used without any fear that something could go wrong. In fact, it's so safe that if you, for example, had to spray it on the brow and it gets into the eye, nothing will happen because it doesn't irritate, it doesn't sting, in fact, it feels quite soothing. And this is all because it's your immune molecule. You can't be allergic to it, you can't react to it. Your body always accepts it and has a pleasing result because of its presence.
Wow. Just amazing, because we have products which have searches, we have so many products in the market, but anyway they don't have any such things as you have, all the certificates and notifications, everything. So Hager, you have a question?
I have a question for you, Grandmasterella. Will this product will be in the kit in the future? Are you planning to have it for the students?
I hear. I know here will be two options. Can be that our academy will be interested to include in our kits, but also can be like that we will have so many attendants from whole world, and they can reach, and they can get this product. I don't know by which way, but anyway, they will get in the market. So they will be sure that they can, to work very safely with our procedures. And I just want to ask now, Hene, tell me how you sell these products. It's possible to get online, or it's possible to get by other ways?
Our products available in Europe, already in the UK, in the Netherlands, in Germany. We supply the product to Tom in the Balkans, and we would definitely be very interested to talk to other distributors in your area, and any introduction will be greatly appreciated. I wonder if would you be interested in seeing maybe a few photographs of what hypochlorous acid can do, or shall we later do this more at a conference level?
Just one, please. We don't want to burn, the surprise for the conference.
Okay.
No, he is not talking about some secrets, he is talking about his product. And maybe you can shortly also speak about your topic in our conference, because you visit My Craft Master and you saw all this material prepared for students,
Yes.
Maybe you have some ideas also how to improve all these things, because we just making aftercare as it was before in many years for these procedures, but now we are talking about next level, new generation of aftercare, and how to prepare our clients before these procedures.
All right, so let me explain how it's done. It's very simple. You don't use anything like alcohol or betadine or chlorhexidine. You only use hypochlorous acid, because as a germ killer, it's far more effective than any of those other products. So it looks and it tastes very similar to water, maybe a slightly like swimming pool water, but it's essentially water.
But it has a smell.
It has a slight chlorine smell, yes, because of the Cl in HOCl. Yes. So it's got a hydrogen, oxygen, and a chlorine molecule. And it's interesting that the body uses a chlorine molecule to give us immunity.
Yes.
But this is not the chlorine that you're used to. This is a very different chlorine from bleach, from the chlorine that goes into swimming pools, and for the chlorine, it's very different from the chlorine that's used as a disinfectant against COVID-19. It is essentially a gas molecule that is trapped in a specific nanotechnology process in water, and it reacts, and it acts completely different. So you have it in a bottle, and the bottle is made from glass, and that is not to react with the molecule, because it is a reactive molecule. You can't have it in plastic because it reacts with the plastic, and then it usually loses the interaction, and it becomes less active. So this molecule also must be protected against UV light, and that's why the glass bottle is white.
Mm-hmm.
And it is in a bottle that has a crimped-on pump, because if you are able to take the pump off, some of the efficacy of the product will go up in the air, and it also prevents the addition of other products in it, because you can't mix hypochlorous acid with alcohol or with other disinfectants, or even put a fragrance in, because then the molecule gets destroyed. So the environment also includes a very specific pH. Now, pH is very important for the skin, as you know that. So hypochlorous acid happens to have the same pH as skin.
Super.
So it is an acid with the same pH, and that's around 5.5 to 5.8. So if you consider the fact that it's called an acid, it's not an acid like a strong acid. It's an acid that's very friendly. You wouldn't even taste its acidity.
Very weak, right?
It is an acid, so we have to call it an acid. So the acidity of it needs to be protected. If you apply it, for example, say you wash and all of these things I will discuss at the conference. If you wash your face with soap, a bar of soap is alkaline, because it's made through a process that involves some alkaline substance and some fat. And this is where the word soap comes from saponification, which means the making of soap. If you wash your skin with soap and your skin is alkaline, and you spray hypochlorous acid on your skin, it has a risk of changing the pH of hypochlorous acid. And if you change the pH of hypochlorous acid to more even neutral, which is pH of 7, or even slightly alkaline, more further away from a pH of 5.8, then the hypochlorous acid changes into something else called hypochlorite. And hypochlorite is not dangerous, but it's not effective. It doesn't have the killing power against germs. It hasn't got the anti-inflammatory effect. It doesn't got the healing effect.
So you need to have, a protocol for that.
You need a protocol, and that needs to be taught. And they need to understand why that protocol is important, because if you know how it is, if you don't understand things, you forget them. So using a liquid cleanser that is in the acidic environment is the thing to do. So you would use a face wash, which is a liquid. You would wash your face, you would clean it, and rinse it off and dry it, because you don't want to spray hypochlorous acid onto a wet skin, because then you dilute it. So you spray it always on a dry skin, and then you leave it to dry naturally. You don't rub it in, and you don't blow or wave over it, because that molecule is excited and it will go. So you spray it on and you just leave it, and then you can start your work. Then the germs are all killed. And the wonderful thing about hypochlorous acid is it doesn't kill the normal bacteria on your skin. The healthy biome of your skin is not affected. Only pathogenic bacteria like Staphylococcus, E. coli, Streptococcus, the things that gives us problems, they are killed. Why? Because it's our immune molecule. Our immune molecule doesn't attack our own bacteria, the good bacteria in our body. If it did so, we'll be in trouble. So this is a fantastic molecule that's gone through millennia of evolution to help us. And all we're doing now is to take that molecule in a high concentration, and we apply it where we want it. So disinfect. If it comes in the eyes, no problem whatsoever. Use it during the procedure, or if you want to use it afterwards, use it straight afterwards, spray it on, and then the client takes that bottle home. And they spray it every 15 minutes. They spray it on the area where you work, because hypochlorous acid only works when it is in contact with skin. And the more you spray it, the more effect it will have. And I'm going at the conference to show the results of a severe inflammation as a result of other aesthetic treatments. And within 90 minutes, it's virtually gone. Now, we are, as estheticians, are taught something that might come up, and that is that you need inflammation to get a result. That is not so. What has been discovered with hypochlorous acid is that it avoids a part of the collagen formation process, which is called proliferative phase, which is the mad phase, the chaotic phase of healing. And it goes straight from injury to the mature phase of collagen formation. So what is the benefit of that? That a healing that was painful and visible and could have taken weeks is literally within 24 hours complete. But the result is not affected. The result depends on the severity of the injury, as it is with anesthetics. So if you do a mesotherapy or whatever you do, the depth of the injury gives you the result. So that result is no different, but it is within a day instead of within weeks. And it's very dramatic to see it. The issue around aftercare that I also want to address and talk about at the conference is that we as estheticians or clinicians should be very careful what we apply to the skin after a procedure. And I talk from a plastic surgeon's point of view if I say to you that after an operation, and remember, if you are going to break the epithelium, you are doing an operation. So a procedure or an operation is basically the same thing. So if we as plastic surgeons did an operation, we would never apply creams or sunscreens or preservatives or formulation ingredients onto that skin afterwards. We would give it time to heal. And that is where hypochlorous acid, I think, could be wonderful, because you have something that comes from the body that is used in healing, and you can apply that after the procedure, and within 6 hours or so, the wound
Sorry,
heals.
can I interrupt a little bit shortly? I just want to be sure we are doing wrong, or maybe we are doing very well. So after this removal procedure, we also don't apply anything, and so our client needs to keep the skin dry, for example, for 48 hours to form the right crust, like a protection against environment, right? So what do you think about?
That is good, but that is better than putting creams or sunscreens or hyaluronic acid or something on. It is definitely better. in fact, another interesting thing that comes up in my mind is that there used to be a popular belief that putting something like petroleum jelly on seals the wound and is good for the wound. That is also proven to be not good.
Yeah.
So the issue about hypochlorous acid is that it assists in all the things that is necessary that you want to happen. It assists in keeping the wound infection free, and it assists in controlling inflammation, not avoiding it, just controlling it, and it assists in healing the wound very quickly. So that's why I proposed that it is the ideal aftercare treatment, because it is just the body's natural response in an enhanced way.
Wow, it's great, really. So maybe today you will show something for us or not? You have some pictures of...
I'll show you a few pictures to just maybe stir your interest.
Yes, we are interested very well, yes.
So let me show you some. If you look at this picture, this is, of course, not fire removal, but it is inflammation created by needling, mesotherapy.
Yeah.
So here is the inflammation after the treatment, and this is after 17 hours of spraying the product on. So you can see clearly how it controls the inflammation. This is an example here. This is 90 minutes afterwards. This is a product. This is a half and half study that we got from the Netherlands. In this side, the right side of the face, hypochlorous acid was sprayed only twice on, and this side it was not sprayed on. So you can clearly see how the inflammation is starting to improve. Talking about the effect on pigmentation, I was talking about its effect on sun damage. This is an early skin cancer with infection. Sprayed on, it heals it very quickly. But I want to show you from your own gallery just these photographs to give you some hope in what hypochlorous acid can do. The problem here is undoubtedly that there was necrosis due to very intense swelling, and this yellowish discharge here is what we call biofilm. Biofilm is when bacteria adhere to a hard surface, and there's some moisture, and it starts to form this gel-like substance, and this protects the bacteria. It's so difficult to get rid of it.
Yep.
Fortunately, hypochlorous acid can kill it within minutes. And we call biofilm a type of infection. So if we say hypochlorous acid kills biofilm, it means it kills the infection. And it's a type of infection that is responsible for complications with scarring. So in this case, you can clearly see that there is a necrosis in the central area surrounded by inflammation. And now when inflammation is present like this, it is a sign that there is underneath this, there is biofilm formation. And if you see here how this biofilm is formed here during a period of separation of this scab here, this dead tissue. And now there is again biofilm here. And we know, this is something I will teach you. If there is inflammation like this, it means that there is biofilm. So biofilm doesn't need to be diagnosed with a microscope or with some special technique. It is present if there is inflammation like this. Now I have a very similar case that we treated recently, and that was somebody that got an injury on the back of the head. Now this looks very similar to your picture there. You can see the ring of inflammation around. There is dead tissue here sitting, and there is biofilm underneath here. So when the scab is taken off, we see here a large defect with inflammation around it. And this is around 2 centimeters in diameter. So it's a large hole, open hole. And if we treat it with hypochlorous acid, and I'll teach you how to treat it, within 2 weeks, it is completely healed. And this is just the last vestiges of an infection, a scab sitting there that will fall off. And now you can also see that the redness, the inflammation here is starting to go. So the wonderful thing about hypochlorous acid is that if you have an injury like this, you can heal it without scarring. So you can take the effects of the complication, and you can sleep at night because you know that there's not going to be scarring. And this is another example that demonstrates this very good. If you see this large wound on the knee and how it just closes with hypochlorous acid, here you can see the inflammation around the wound. There's biofilm here, like in all the other open wounds that would happen as a result of infection. And if you control the infection, now the wound starts to close, and within 2 months, that is the mark that is left after we start here. Now, what is the potential for dealing with complications like this? You literally take your worry away, and you provide your clients with a normal-looking area after the healing is complete. And that, I think, is a fantastic opportunity to take some of the concerns of what could happen away, other than, of course, avoiding them.
Amazing, just amazing what I see, and you give me hope, that we never anymore we will have some complications. As you know, we teach our students not to work very deep and just to work in epidermis-dermis junction. But, some, they are very brave, they try to experiment, and we are doing some searches by themselves and without any additional educations. That's why sometimes we have a scratch with, and accidents. But anyway, if it will happen, so we have all the options to help to our clients to heal in more fast way, more safety way, and without any pathological changes in the skin. And I'm really happy that, and we will wait till you will be able to travel to our conference, like as other, our masters from whole world. Yes, and also, I think so. I will give you some special, specific material to prepare your presentation more. I don't know. He, of course, now is excellent, your presentation, but I will give many interesting things.
I would appreciate that. Thank you.
Yes, and next thing is also when we finish our procedures and skin is already open, I wrote that it's possible also to spray and to get fill, which is also like protection after procedures, because we have a lot of lymph coming to the surface also, during 2-3 hours and sometimes more.
Yes. The idea of aftercare would be to leave the wound as undisturbed as possible and just to apply hypochlorous acid regularly to control the potential pitfalls that are associated with any procedure. So I remember a professor of mine used to say, if you don't get complications, you're not operating enough. So this happens to all of us, but I feel that it is a huge help to have something that can assist you and limiting that to a large degree.
Yes, for sure. So it means that we finish our procedure and we give a bottle of, GF2 or GF1, for our client to get home, and always to make this spray. Yes?
Yes, GF1 is used on the day of the procedure. It's a stronger product than GF2 because it needs to deal with potential plasma or leakage from the wound, and it's a specific quality of hypochlorous acid that it is it is sensitive to wound leakage or blood or plasma, and therefore we make it slightly stronger, not because we want it to be strong, but because we want it to be strong enough after it reacted with the plasma. In GF2 is used from the second day. So if you are interested in reducing the overall inflammation in the skin and improving the skin's texture and fine lines and wrinkles and color and things like that, just giving you a better looking skin, then of course GF2 is there to follow up with GF1 and give your clients long-term benefit of hypochlorous acid, which is quite remarkable, like the improvement of pigmentation, breakouts, rosacea, and those things. But in general, just giving you a more beautiful skin. But I will also lecture on that, exactly how it happens, because the procedure has been described exactly how the skin becomes younger if you apply hypochlorous acid regularly every day onto the skin.
I need to apply since tomorrow.
Yeah.
Yes, and it needs to be in each pharmacy, I'm sure, you know. So I think so, and I wish you that one nice day, yes, it will be possible to buy in each pharmacy, because yeah, everything what you describe, you know, is just amazing, and it helps for a lot of cases. It doesn't matter what you are doing with the skin, right?
Exactly, yes.
Hager, do you have special questions to our Hene?
Yes, I'm sorry. I've been missing some of what he's saying because of the storm, and it's been cut off.
Still, you have
yes, doctor. Yeah, it's getting back. We had now storm and wind. I mean, too much rain, and it's okay.
I can hear.
Doctor, I wanted to ask you something related to Phiremoval. Yeah, it is a question about Phiremoval. As a doctor, how do you see the future of the Phiremoval in our industry? Amazing product for removing unwanted pigment from under the skin. And how do you see the product itself for the benefit in the skin?
I think it's a fantastic product. I think it is a very natural type of removal of pigment. I think it has a very strong future. I think it has a fantastic help for people who need that assistance. I'm very keen to learn more about it. I don't know enough like I want to know about it. I don't even know if it is available in South Africa. I hope it is, because it really looks like a fantastic system.
Good. And I have another question. Do you think that this product is like the product that you have been talking about now, the one that you use before the procedure and after? Do you think that Grandmaster Ella created such a good product for the skin? Because there are so many in the market, as you may know. Do you think that Grandmaster Ella product that she made with love is?
Absolutely. Yeah, you know, permanent makeup is a fantastic business. It's a very big business, and to have something with the potential to correct or to improve. It's a natural process that it must follow. And what I'm particularly impressed about with your organization is the organized structure of it and the passion that goes into the product. That is really something close to my heart, because I feel the same about what I do. And if we have the opportunity to work together, and I really hope so, I would do everything possible to make it and whatever hypochlorous acid can do to enhance the system, we would bring, so that you have even a more fantastic product. I think it is certainly in this age of quick results, more dramatic results, people want it. It comes at the right time. It is without a doubt a wonderful concept. Well done. Really
it's amazing thing what you're telling now, because, and I need to be clear, Hager, because it's not me who created these products. It was a team who, you know, always consulted, and I was also consulting our The Academy team and working on these products. Also, special working on pH, you know, because pH, as you know, always is very important for each product which is going onto the skin. That's why then I listen this. I think that our cooperation is going very well, and we will create new products in the future for sure. Because I like also to make for this unwanted tattoo removal, just to reach the level, then you need just several procedures, not 10 procedures, as you know. Because with laser also, you need a lot of procedures if you want to remove. And still also some shadows in the skin you will find always, some remains of pigments. Our goal is to create a product which can remove till 0 to 0 and to use just several procedures. And we're working on, I try also different needles, different devices. It comes also from dentists, some devices now. And I use also different tips now. And I like now to introduce in our conference completely new 2 techniques, because yes, it made for me good impression that on some types of skin it goes so quickly to remove, all this it's very old pigment with fibrosis in the skin. And of course, it could be new products with other acids, and it needs to be, of course, very gentle to the skin. But anyway, I'm not scared to work with high percentage, products. For example, 70% of glycolic acid. I work very calm and the results are very great. So it depends how many procedures you made in your life, and how your educations and everything. It has important things. That's why our cooperation is very important for us. And I think so that you are one of most attractive persons and speaker in our conference, because everyone was waiting our live and wanted personally to see you and to listen you, and you are speaking very understandable, because you're a doctor, and sometimes speech of doctor, sometimes, oh my god, you listen and you're thinking, okay, how many things I don't understand, even I speak English. But if I listen you, I'm sure that all attenders in this conference will understand everything. Yes, because we will have students from whole world and they have different background, you understand. So our presentations needs to be very simple, but and in another hand, they need to inform and we need to develop all things what we are doing now.
That's really very interesting. The issue with glycolic acid is that it is really a fantastic product. It is a small molecule.
Exactly.
And that makes it so versatile. And I think you've done fantastic to find that out and to develop it. I became involved with glycolic acid in the early 1990s in developing a skincare range known as Nimue. And that was one of the principal ingredients. But in terms of the removal of pigment, I was very surprised to see that could happen. And I immediately felt that it's a safe molecule. It's not going to create big problems ever, because it is a natural part of your human body. And I think the results that I've seen are fantastic. It's magnificent, really. You've done really well.
It's true. Even it's very well work on Fitzpatrick number 5 and 6. Also, it works. Also, very well works on Asia skin. And so we have, masters in whole world and in the special countries too. And when they send their works, I just, always have big pleasure that we really created very great method to remove unwanted pigment. And especially we have cases after laser procedures, after 10, 15 laser procedures, and we see some shadows in the skin, but we can already to say that almost to 0, it's possible to remove with this method.
Yeah. Yes, I look forward to seeing some results.
Yes.
So have you got any idea when you want to have the conference?
No, we don't have, any exact date, because as you see in France, we have again increasing cases, and it's impossible to travel without any quarantine. So many masters and speakers, they are coming also from Latino and South America. We have any chance to come. So we just need a little bit to wait, and but I have hope, and I am optimistic as Hager that very soon we will have, what means for us 3 months or 5 months to wait. It's nothing. It's going so quickly. So again, yes, and we will make again some live streams of you, if you will agree. And again, we will talk more about very special things, because I will send, as I promised, some special material to you to consult. So we will be interesting for our community, for sure.
Thank you. Yeah, I'm looking forward to that. Thank you.
I will send you amount of viewers who are looking us now. You will see, you will be amazed.
Yes.
Great, thank you.
Yes. And, Dr. Hani is not only the most attractive person in our conference, but he's one of the most important one, because his presentation is very, very important for any artist, royal artist, or master assistant, all the skin experts of the academy, and his presentation is going to add a great value to our work, to our career, and the future for a new student to be that are registered, and the one who will be registering to see Dr. Hani presentation is a premiere in the PMU industry.
What I would like to ask, we have a lot of theory and a lot of results around similar sort of situations, but none of them are on actual fee removal. Would it be possible maybe to send you some product and you can do some use it and get some experience with it?
Yeah.
Because that might be very valuable before the conference.
I know what it is. Yeah, I was attending some searches, so German products, for example. So we can make together, some projects.
All right. So if you would give me your contact details on email, I will see that you get product to start using it.
Thank you very much. Yeah, we'll do it.
Okay.
That's very kind of you, Doctor.
Thank you. It's a pleasure. No, I think we need to do that to share some first-hand experience for the conference.
Yeah,
and we'll have time for that. That's great, because I'm allowed, for example, in my country to perform all these procedures. Till now, we are not close. So I'm happy and I will do it. Everything is possible, I will do.
Okay, good.
This will give another great boost to Phiremoval worldwide. It will give something, it will add a big plus. Thank you so much, Doctor. Thank you so much.
I think it's important that people get it in their hands to use. And that's the best experience is your own experience. It really is something that would convince them very quickly.
Yeah, because Phiremoval is not a procedure for beauty. We are not enhancing someone like doing eyebrows, lips, something to make them look beautiful. It is really, for me, Phiremoval is a humanitarian treatment, because it helps a lot of people who are struggling with unwanted pigment, something bad on the lips, on the body. It is like it is a procedure of help. It is not.
That's right. We call our company's logo the restoration of dignity, giving people back their dignity.
Yeah, absolutely. Yeah, this is the right word. Thank you. Yes.
And I have next idea, then it will be possible. You need, someone needs to organize your teaching and your education in Europe for sure, because everything what you are telling is so interesting, and we need to have this, as soon as possible. So we will look for this organization for sure, and I am sure that we will have so many attenders. I am sure.
Yes, we would love to be
I would appreciate that very much.
We will be your organizer.
Thank you.
Yes, it can be in France, it can be in another country, but for sure. But anyway, it needs to happen separated also, from this conference too.
Good. I would love to do that. Thank you.
Very good idea, Grandmaster Ella. You are always full of great, bright ideas.
Oh, thank you very much. You too, dear. We both always, always it's like a team, finger crossed.
Yeah, we are sisters. You are my sister.
Yes, we are sisters. Exactly. Because, Joanne, we are thinking about conference, not only just this one, first one. We are thinking about next year too, because we're supposed to do this conference around the world and every time in different countries.
Yes.
For example, from yesterday, we have already invitation to do it in Mexico. Yes. The next conference will be in Mexico because second one will be in Tunisia.
North Africa.
It is so. Yeah. Just as with plastic surgery, it should be part of the fun of what you do is to visit different areas and to see the beautiful things of that area and to enjoy the fantastic food of that area. It's part of the whole experience of what we do.
Yeah, it is a different culture and a different type of skin.
Yes.
Yeah, and different people, different way of thinking. And Grandmaster Ella and me would love to do the whole world. We will do Phiremoval around the world. Now it is worldwide, but next year we will change our slogan to around the world. Maybe our conference will be twice a year because we have so many people who wants to have it in their country. We have a master, amazing, very, very nice master. I love so much. Master Antonio from Spain. He would love also to have a conference in Spain. And maybe we will have one in South Africa, Doctor.
I hope so. I certainly would like to see the system introduced here. We have a big affluent community here. I think there are around 1,500 aesthetic clinics in South Africa. And everybody I've asked have never heard of Phiremoval.
Yeah. Also, I think so that Dr. Hene, you need to make my way, as I did, 3 years before. I visit 64 countries, and I educated a lot of students, almost 2,000 students around the world, and some of them, they also made some career. They became royal artists, master assistants, and now masters, Phiremoval masters. And now they have right to educate their students in their countries. So you need to have the same system, and it will work. It will work for sure. Be sure.
Yeah.
I think so. Yes.
Definitely. And your presentation is not only for Phiremoval. All other PMU treatments, they will need you, doctor.
It is developed for invasive treatments. Yes.
Yeah, because we have scalp micropigmentation, we have the paramedic for areolas, we have for vitiligo camouflage, scar and burns camouflage, we have stretch marks camouflage, we have lips, eyeliner,
plasma lifting, also.
We have needling. Around the world, there are so many treatments, different treatments, and every now and then you hear a new product and new PMU treatment. And I believe that all these treatments needs Dr. Hani.
Thank you. I hope to be of assistance. Thank you.
Yeah. So we like to thank you for beautiful conversation. We will not talk with you about gala party. You are too serious for that. But anyway, we will have, in our conference for sure. Because in beauty industry, we have beautiful women in us, so we like to have always beauty parties.
Oh, yes, I love it too.
And so next time when we will meet us again in live stream, we will have things to talk for sure, and everyone will wait next time. Yeah.
Thank you. Thanks a lot. Thank you for asking.
Yeah. Okay. Shall I tell you a little bit about our gala dinner, about the 5th anniversary that is going to be postponed, unfortunately. It's supposed to be on the 21st. It's the 5th anniversary of Grandmaster Ella's baby, Phiremoval. It's a pity that is not going to be celebrated on time, but
it will be in time. It will be in time, because it was not like birthday in one day. It was developed during one time, during one period. So
yeah,
that's why.
it's okay. It's okay. We will celebrate it on anytime. Our gala dinner, doctor, is going to be very special. All the attendees, the masters, the students, participants, they have to wear a special gown. It is a dress code, the traditional gown of their country, that representing the culture. And they have to look the best, not only in the dress, the gown, but in the hairdressing, the way they wear the makeup, like the ancient people. And there will be first only one prize for the winner, who is going to be amongst the masters and doctors. Maybe doctor, if you wear something nice, you will win.
Oh, remember. But you might be surprised coming from Africa.
Yeah. You can bring with you an elephant, Make it go. So the gala dinner is going to be very entertained with international music and Arabic music. We will have a special stand where all these multinationality culture also will take photo with each other. They can, chat and take souvenir selfies. We have also very important two guests, two very important Phi Academy personality. We have the number one Grandmaster Branko Babic. He is the founder and creator of Phibrows and Phi Academy, and the owner of Phi Shop, Mr. Milan Momirovic, who they're going to go on stage and make a speech of motivation and to tell to all the participants and people assisting about how it all started with them, how they succeeded and became, like now tycoons of the world. And they can take photo with them, and they can probably ask questions also.
Yes,
the personalities are very famous in the beauty industry. And we have also a very important doctor, Dr. Hani, who is coming from South Africa. And it is a premiere worldwide. Nobody did this before. And we are very happy to have Dr. Roos with us. And voila. And there will be a souvenir, very important souvenir gift of Phiremoval worldwide to every person assisting, whether they are student, participant, masters, all of them. And this is this is number one. It is the first conference worldwide, and hopefully there will be every year one or maybe two that Grandmaster Ella will decide. Of course, the second one will be in my country, in Tunisia, and then Grandmaster Ella will decide which is the next country.
Maybe you can tell a little bit about this hotel El Negresco.
Oh yes, the conference will be held in the very prestigious hotel Le Negresco, very very ancient, that has a very amazing, brilliant history. It is on the Croisette, the famous Croisette in Nice, France. It is surrounded by many amenities, boutiques, casinos, nightclubs, posh restaurants, and it is the hotel of the luxurious lifestyle people who travels from around the world to go to this prestigious Negresco. Our gala dinner also will be held in this hotel.
Wonderful.
Yeah,
have you seen the room of Dr. Roos? Have you seen all of them?
Dr. Roos will be staying in a very beautiful room that is overlooking the Croisette, and it has a history. It is the room where Princess Eugenie. I will not spoil it. It is. You have to bring with you your wife so you can feel the moment. It is very, very romantic story of that room that very two grand personality of the world spend their nights there.
Thank you, but I'm not married. So.
I'm not married.
We will find who married in Nice. Yeah, I'm sorry.
So maybe in Nice, maybe this room will be it will bring the luck for you, and you'll find Mrs. Right.
Who knows?
Okay. Okay. Our doctor is shy, so we need to be a little bit more light with his jokes.
I want to say something else to the audience, that Dr. Roos has never had before a Facebook, and he just created an account Facebook just for Phiremoval worldwide live stream. Thank you
very much, Dr. Roos, because you made this step, oh my God, to create your profile. It's something special, really.
Everybody's on Facebook. It's time for me to catch up.
And the doctor will not forget about Phiremoval, never, 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 ever, because he had his first live stream with Phiremoval worldwide.
Thank you. No, I will never forget. Thank you. I'm looking forward to cooperation very much.
Thank you very much. Thank you very much for attendance. Yeah.
Okay. We won't leave you long. We know that you are a doctor and you have the duty. I'd love to make a 5 hours, live stream with you, but I know your time is very, very important. We're going to say bye for now. Until we meet again, we have to invite you once more before the conference. Grandmaster Ella?
Okay, next week we will have some surprises, and I just want to keep it in secret, okay? It will be very, very interesting persons again.
Wow. I think I have I won't say. I can imagine.
Thank you. Thank you for asking me.
Thank you so much, doctor. And
have a nice day and good procedures. Yeah, successful procedures. Yeah.
Thank you. And, have a nice day.
Thank you. You too. Bye-bye.
Bye-bye.
Grandmaster Ella, this is amazing live stream. I really, really, first time I enjoy the live stream with an open eye, because everything he was mentioning, saying, showing is amazing.
He's very professional, Yeah, we just talked a little bit, and yes, of course, he had possibilities to look to my craft master, but anyway, he immediately made decisions, conclusions, and as you see, we have already a new presentation for our conference.
Yes. I think his presentation is going to be very quiet. Everybody is going to be quiet and just focus, because if they miss a little word, or I don't know, a little sentence, they are finished.
We catch, our, we say like this, we catch fairy bird, and this doctor will help us to develop our beautiful Phiremoval, and it will make till perfection.
Yes. Grandmaster Ella, I want to thank you also, because your idea to have this doctor in the Congress is it's amazing.
We need everyone. Everyone needs,
not only the doctor, all the people you invited, all the people you thought about them, to have them in the first Phiremoval conference worldwide are top. big names. We have Grandmaster Branko, we have Milan Momirovic, we have Dr. Roos, we have all the 24 best masters around the world. We have you, Grandmaster, on top, like the sun shining on all the stars. Wow.
Yeah, I think so that new masters also coming soon, they that just started to work as masters. And some changes can be, of course, in our team, but anyway, it will be also the same level, good level, and they will be speakers. Yeah, it's not always is possible to keep the same, persons in between us, but I am sure that you will be satisfied with all our speakers, because we will check all presentations which will be here in our conference. I will check personally. If I will like something to improve, I will ask our speakers to do that. So that's why if you will attend our conference, you will be, you will get all news, innovations, and of course, you will see personally your favorite masters.
Of course, and not only this, you will leave the conference full, like having, a lot of luggage. You're going to go a lot of luggage back here. You're going to have a lot of informations, techniques, new tools, new products. You're going to be really, you will feel like a bird flying free, and you're going to go back to work full of energy, to practice what you have learned in the conference. Absolutely.
Okay, so day is already almost midday, so we need to go to work again and to perform our procedures and to bring again something new for you for the next life. So every day bringing something else, and we are happy that you are watching us and listen us, and we enjoy that our community is really growing very fast.
Yes. Grandmaster Ella, who is our next guest?
In secret, dear.
It is secret.
Still
Wow,
secret.
okay.
Yes.
Wow. Okay.
It will be announced, I think so, on Wednesday.
Wow. That's good. Amazing. So we will say goodbye to the people watching us, and don't go away, because I want to know who is this surprise.
Okay,
thank you so much, everybody, for watching. Grandmaster Ella, thank you so much. And
goodbye for everyone. See you soon.
Yes. Grandmaster Ella, please don't go away. Bye-bye, everybody.